Significant hormonal changes take place during pregnancy. These trigger a variety of symptoms. Some women experience many of the symptoms of pregnancy, while others may have only a few. Missed period. Missing a period is often the first sign of possible pregnancy. However, some women experience light bleeding around the time of their expected period. Nausea and vomiting. Morning sickness is a condition that affects more than half of all pregnant women. The symptoms include nausea and vomiting, and loss of appetite. Many women with morning sickness don't just get symptoms in the morning but experience them throughout the whole day. Morning sickness usually begins around the 4th to 6th week of pregnancy and may settle by week 12, although it can continue for longer or return at around 32 weeks. Breast changes. During pregnancy, the breasts become fuller, swollen, and tender. These changes are similar to those you may have noticed in the few days before your period. During pregnancy, the skin around the nipple becomes darker and the veins in the breast become more obvious. Fatigue. Overwhelming tiredness is common in early pregnancy. This is most likely caused by the massive increase in the sex hormone progesterone. Progesterone is needed to maintain the pregnancy and help the baby to grow, but it also slows your metabolism. Try to get some more sleep or rest when you can during this early stage. Your energy levels will probably rise again by around the 4th month of pregnancy when the placenta is well established. Tiredness during pregnancy can also be caused by anemia, which is most commonly caused by iron deficiency. Eating iron-rich foods is important in the prevention of iron deficiency anemia during pregnancy. Medical treatment of anemia in pregnancy usually involves taking iron tablets. Sometimes an iron infusion is needed. This needs a hospital admission but only takes a few hours. Some iron infusions can be given by your GP. Frequent urination. Pregnancy causes an increase in levels of body fluids and greater kidney efficiency. The swelling uterus also presses against the bladder. As a result, most women start experiencing more frequent urination within the first few weeks of becoming pregnant. Food cravings. Cravings for certain foods are very common in pregnancy, especially for foods that provide energy and calcium, such as milk and other dairy products. You may also notice a sudden distaste for foods you previously liked. Some women even develop an unusual taste for non-food items such as soil or paper. This is called a pica and may indicate a nutrient deficiency. Please speak to your GP or midwife if this develops. Other less obvious signs and symptoms of pregnancy that you might experience during the first trimester include moodiness. The flood of hormones in your body in early pregnancy can make you unusually emotional and weepy. Mood swings also are common. Bloating. Hormonal changes during early pregnancy can cause you to feel bloated, similar to how you might feel at the start of a menstrual period. Light spotting. Light spotting might be one of the first signs of pregnancy. Known as implantation bleeding, it happens when the fertilized egg attaches to the lining of the uterus, about 10 to 14 days after conception. Implantation bleeding occurs around the time you would expect to have a menstrual period. However, not all women have it. Cramping. Some women experience mild uterine cramping early in pregnancy. Constipation. Hormonal changes cause your digestive system to slow down, which can lead to constipation. Food aversions. When you're pregnant, you might become more sensitive to certain odors and your sense of taste might change. Like most other symptoms of pregnancy, these food preferences can be chalked up to hormonal changes. Nasal congestion. Increasing hormone levels and blood production can cause the mucous membranes in your nose to swell, dry out, and bleed easily. This might cause you to have a stuffy or runny nose. Home pregnancy tests. If you do a home pregnancy test, a positive test result is almost certainly correct, as long as you have followed the instructions correctly. A negative result is less reliable. If you get a negative result and still think you may be pregnant, wait a week and try again. Can you feel pregnant before you miss your period? Yes, you can feel pregnant before you miss your period. Some people say they felt pregnancy symptoms within a week of conception, about 1 week before a missed period. Could I have the symptoms of early pregnancy and not be pregnant? Many of the symptoms of early pregnancy overlap with other medical conditions, as well as your typical menstrual cycle. Premenstrual symptoms can be very similar to pregnancy symptoms. This can make it difficult to tell the difference. You can also miss a period and not be pregnant. This can happen when you lose or gain a lot of weight or are stressed. Breastfeeding can also cause your period to stop. Still, if you miss a period and notice some of the above signs or symptoms, take a home pregnancy test or see your healthcare provider. If your home pregnancy test is positive, make an appointment with your healthcare provider. The sooner your pregnancy is confirmed, the sooner you can begin prenatal care. The best way to know you're pregnant is to take a pregnancy test. Pregnancy tests are available at your local pharmacy or grocery store without a prescription. If you're planning to conceive or just learned you're pregnant, start taking a daily prenatal vitamin. Prenatal vitamins typically contain important vitamins and minerals, such as folic acid and iron, to support your baby's growth and development. Thank you for watching this video. Subscribe to my channel for more videos.